Hi everyone, and thank you for being here, and thank you very much for the invitation to come and chat to you all today. Now I'm actually in Sydney, so it's 5 o'clock, so what you might find during my presentation, the light will start going down, but I know it's 7 o'clock for you guys in New Zealand. And I'm here to chat to you all about nutrition after cancer treatment. So my name is Dr. Jennifer Cohen. I'm a clinical dietitian from Sydney Children's Hospital, and I've been working in the Kids Cancer Centre at Sydney Children's Hospital for, let's go with 15 years. I think it's a little bit longer, but let's say it's 15 years. We'll round it down. And I'm also a senior research fellow with the University of New South Wales. So I've always had a joint role as a clinical dietitian and researcher. And obviously my specialty is nutrition during cancer and after cancer therapy. So I've got a presentation for you all today. Now there is a chat box, which I can't see when I'm presenting, but afterwards what I will do is stop sharing my screen and then I'll be able to see all your questions. So leave all your questions to the end and feel free to ask as many questions as you like. And hopefully you guys can all hear me. It's always funny with these webinars. I actually feel like I am talking to myself. So I think I will get started. So I think because I can't see the chat box, I'm not going to ask you guys questions. And I normally when I do this, obviously face to face, I like to do this as a hands up. But I just want you to think about it because I can't get the answers with the chat box. But how many parents have found that their child's diet has changed as a result of their cancer treatment? And again, I'm just pretending that all of you guys are putting up your hands at the moment or thinking about that. And the answer is that I'm sure a lot of you said they have changed. And this is actually where my research has been. And when I did my PhD was looking at childhood cancer patients' dietary intake once treatment had finished. So I work day to day with patients during treatment. But what I found is that I was spending a lot of time during treatment trying to prevent weight loss, which I'm sure of you have had a lot of that, those issues during treatment. But once treatment finished for a lot of these kids, I found that I was getting lots of questions and lots of referrals from the doctors for kids whose eating had kind of gone in the opposite direction. So they were either eating too much and putting on weight, or they're having lots of problems with the kind of foods they're eating. And at the time, this was quite a few years ago now, I realized there was actually not much in the research space about what's happening with kids' diets once treatment had finished. There was a lot of work around what happens during treatment. And as you all know, we see a lot of eating go down and lots of problems with weight loss. But there wasn't really much going on after treatment. So that was, I guess, really where my research came about, is I wanted to look at what was happening for kids once they finished treatment. And a lot of you might find that this story that I'm going to tell in the next few slides is something that really resonates with you. So what we did as a group is we basically asked parents what's happening with your kids' intake after treatment. I had seen it when I was seeing parents, but we hadn't written anything down. And I asked parents to think about what their child was like before they got sick, and then kind of what happened during treatment, and then what was happening now. Now, obviously there was a little bit of recall happening because there had been a lot going on before they got sick and afterwards. But most parents said, look, before they started treatment, they were an okay eater, you know, no different to all kids, maybe a little bit of fussiness, but, you know, 80% said they were a pretty good eater. They didn't really worry about their kids eating and they were okay. But obviously during treatment, they saw a dramatic change in their child's eating habits. And we know this. They saw lots of kids if they were eating, they were eating lots of sort of savoury snacks, a lot of salty foods, lots of kind of carbohydrate foods, so chips and bread and pasta, those kind of really kind of salty and easy to eat foods. And definitely saw a decrease in things like meat and fruit and vegetables, and even saw a decrease in dairy intake. Even though as dietitians, we tend to try and encourage that. We definitely saw that. But then what they were saying is what was happening after treatment was almost, not kind of the opposite, but there was a definite shift in how they were eating. So what they were finding is once their kids had finished treatment, that a lot of them were saying that their kids were tending to overeat, if anything. So they'd spent 6, 9, 12 months trying to get their child to eat during treatment. And then once treatment was over, they found their child was going in the opposite direction. And this was a quote from one of the parents that we interviewed. Volume-wise, I'd say she eats more than most of her friends, and she's certainly on par with her 8-year-old brother. So about 60% of parents were said that their child was definitely overeating. 90% reported poor fruit and vegetable intake. So he started as healthy eater and would eat anything, but now he doesn't want any fruit and vegetables. So that poor fruit and vegetable intake that we were seeing during treatment was continuing off treatment. 100% of parents, and this was about 18 parents that we interviewed, reported an increased desire for junk food or non-core foods after treatment. So that was the kind of pattern we were starting to see. And this was one of the first studies, I guess, in the research that was published showing what was happening with the dietary intake of patients. But there was also those on the other side, and I'm aware of that as well, that there were, say, about 20 to 30% who were still worried that their child wasn't eating enough food. And sometimes it wasn't a volume thing, it was just they're not eating the right kind of food. So one parent was saying, only eat salty carb foods. This was a dad actually. So her mother has her own multivitamins and she doesn't put on weight. So I guess we were seeing both extremes. There was a small subgroup that was still having lots of problems with weight, but then this other group that we really hadn't even focused on were having lots of issues with sort of weight gain. And again, what we did is we also assessed their dietary intake. So we asked parents to write down everything their child was eating and drinking. And again, this is once they'd finished treatment. Now, this was early off treatment. This was within 5 years of finishing treatment. And we found that over half of the kids that we got their diaries done, so it was about 50 patients, over half were consuming excess energy. So too much food, basically. And we saw that about a third weren't meeting their calcium needs and a half weren't meeting their folate needs. Now, these were nutrients at the time. We've done a lot more work since then. But again, we were all of a sudden, we were realizing that maybe the diets off treatment weren't as good as we thought they were, or it was something that we were going to have to start focusing on. And what we also looked at is we also talked to parents about kind of the different food groups and how that changed over time. And again, this is interviews, but if you can see, I don't know if you can see my pointer, you know, the blue was the prior to treatment. So, you know, 16 out of the 18 parents, this is numbers of parents, sort of thought, my kid eats enough vegetables. And then on treatment, they ate none, or none of them reported that they were eating enough veggies on treatment. And then afterwards, you know, maybe a third were saying that they were okay with their veggies. Similar kind of pattern with fruit, whereas the carbohydrate intake just kept going up over time. So this is your breads, your pasta, or your rice. Parents just felt like they were eating more and more on treatment and then off treatment. Dairy was sort of went down and then back up. And savoury snacks I loved was sort of, most parents said they were probably not eating too much. So it was about 6 parents were okay. And then almost basically 100% of parents said that they worried that their kids were eating too many savoury snacks, both on treatment and off treatment. So we were definitely seeing those patterns emerging from what the parents said. So then what we decided to do was, this was a lot of parent report, and this was my early work where we looked at food diaries. And then what we did was we actually wanted to look at dietary patterns, because what we realized, and this was also has the research has gone over in the last sort of 15 years, is that all of us eat food, we don't eat nutrients. So what we wanted to look at was food patterns, because it's also food patterns where we can actually do something about. Now, this research I'm about to show you hasn't even been published yet. I haven't really presented this data before. It's slightly data we collected in about 2016, but hadn't been analysed yet. And we're looking at putting this paper in to publish in the next couple of months. So guys, don't tell anyone this data. But this was where we, again, took different patients off treatment. And we had about, I think it was about 60 patients early off treatment again. But what we did this time is we compared their diets to those kids who were around the same age who hadn't been through cancer treatment, because we wanted to actually do a bit of a comparison to see, because as we know, most kids, and I'm sure in New Zealand, because Australia would be the same, is that, you know, kids generally overall don't have great diets. Only 4% of Australian kids have enough vegetables. So, but we wanted to see how they were comparing to the kids who didn't have cancer treatment. And again, what we found is sort of similar patterns, that compared to kids who didn't have treatment, kids who'd had cancer treatment definitely had a poorer overall diet quality. They were consuming more, especially sugar-sweetened drinks than the kids who hadn't had treatment. But I think what was most interesting from this research is we did a fussy eating or a picky eating scale. And a higher percentage of parents whose kids have been through cancer treatment thought their kids were fussy eaters or picky eaters, compared to 30%. So we're definitely seeing more parents, and these were the same ages, the ages were the same, worried that their kid was a much fussier eater. And again, what we found is the younger a child was diagnosed, the more likely they were to be fussy when they finished treatment. And we'll talk a bit more about that as well. So I found this is really interesting research. And again, hopefully it'll be published soon. So you guys are one of the first to see these results. And again, so I've just talked about our research. It's not just about us. Plenty of people overseas have also been doing some really great work. And unlike Australia, where we're probably a lot more smaller numbers compared to America, so a lot of these studies are bigger studies. But again, what the studies we're seeing overseas, especially in America, were very similar patterns to what we're seeing with our families. And I'm sure was happening in with New Zealand families as well. So again, this was a larger study looking at kids specifically with leukemia, ALL. And again, this study found that the kids after treatment, early after treatment, had sort of an inadequate intake of the green veggies and the beans and vegetables and fruits. And interestingly, none of the survivors met guidelines for dietary fibre, which is actually really important. And again, for vitamins, for vitamins and minerals, especially things like sodium, calcium. So they were either eating too much, they weren't having enough vitamin D or calcium, and too much sodium and saturated fat. And again, they found the same as us, that the younger a child was diagnosed, the more likely they were to have poorer quality diets down the track. Now, I have just realised I have kind of worked out how to look at the Q&A box during it. So I will come back to the questions. And I think there is also a place where you can raise your hand as well. So again, there's similar patterns is being seen overseas as well. Okay. Not going to go for me. Oh, here we go. And again, that was a lot of my work was, you know, kids sort of early off treatment. But what we are seeing is similar patterns into adulthood. So I'm not going to go through the lots of studies that have been done. There's some really big ones that have come out of both America and Switzerland and Europe. But again, in adult survivors of childhood cancer, we're seeing, again, low fiber diets, high energy diets, so too much energy, low fruit and vegetables, high fats, but also not the kind of good fats, but the more saturated fats, and low calcium. So again, the patterns we're seeing in adult survivors of childhood cancer, we're seeing early off treatment as well. Now, a lot of you may be asking the reasons for this, and I have a few thoughts, and there is a lot of information in the research, but the reality is we're still trying to work out what's exactly going on. And I think there's a few things going on. So the first one is, I guess, effects of the medication, especially things like steroids. We definitely see that steroids can kind of cause lots of issues. The thought is, but we haven't proved it yet, is that the steroids can change how kids, basically our appetite. So appetite, I don't know why I'm pointing to my head. Appetite is actually, it's a hormone that goes into our brain. So the hormones are released from our stomach, and there's certain appetite hormones that tell us we're hungry and certain ones that tell us full. And then those go up into the brain, and that's where we tell if we're hungry or not hungry anymore. And the thought is that these kind of hormones, so one of them is called leptin, and that's the one that tells you you're full. The steroids, this is patients, especially kids who've had acute lymphoblastic leukemia. So I think we're in very similar protocols. I think the same protocols. So get steroids, 2 lots of steroids throughout the treatment. We think it changes that appetite regulation. So kids aren't getting that signal saying they're full. And that's why we're seeing some of that overeating. So we're thinking, again, it's just that change in appetite, and they're not getting the signal saying that they're full. We also think that it's a lot to do with exposure. So, as I was saying, that a lot of that early research those research that we found and other people have found, that the earlier kids are diagnosed, the more likely they are to be fussy. And I'm sorry for those who've got kids who are really young when they were diagnosed. You're probably going, no, what are we going to do? So I am sorry now. I'm sorry. But I think it's a lot to do with our habits and our eating habits for all of us get established when we're really young. So the first few years of life. And if you have a diagnosis during that time when you're quite sick from the treatment, you're not, I guess, exposed to sort of good eating habits on treatment, because your kids aren't feeling like eating. So tending to eat kind of those more carbohydrate foods, a lot more junk food, and as we know, not much fruit and vegetables. So they're not getting exposed to those foods. So they're not learning actually how to like it. So it's a bit like not sort of not being exposed to them means that they're not less likely to like them down the track. Also, just the treatment making them feel pretty yuck, and potentially getting things like food aversions, or just, you know, if they've had a food and then they've been sick after it, they're not going to feel like that food for a while, and it could be a long-term thing. So we think the treatment is changing things, but there's also other ways that we think the treatment could be changing. Could be changing the gut microbes, so the good bacteria in the gut. And there's a little bit more work being done there. Not enough for me to talk about yet, but it's something that really interests me. And we think that can change how kids sort of, yes, their regulation with eating. And there's also just, we also think that there's some potentially issues with change in taste and smell. And again, this is early research and it hasn't really been sort of proven, but we know that the chemotherapy can affect taste and taste buds, because taste buds are rapidly dividing cells, and that's what chemotherapy targets. So and a lot of you may have had your kids not wanting to eat on treatment because food tastes yucky. And most of the time those cells regenerate, and so the taste does come back. But we're wondering if for some kids it's a bit more permanent. And I did a study on adult survivors, so these were older, and we found about 10 or 12% we think had some kind of taste dysfunction after treatment, compared to what you'd see in the normal general population, which is about 1%. So as you can tell, there is a lot of things going on, and we can't just say it's one thing going on that's changing the diets, which makes it harder for us to go, what can we help with the diets down the track? But again, a lot of it, I think, still comes down to that eating habits formed in childhood are likely to continue into adulthood. So if they're missing out on some of these, you know, early exposures to food when they're sick, means that it might cause sort of changes in their diet and their food habits down the track. Now, why do we actually care? So probably in the last, probably now coming up to sort of 15 years, there's been a lot more work looking at what's going on for patients once they finish treatment. Now that, you know, treatment protocols are, you know, are doing such good things for kids, and we're seeing, you know, survival rates just going up. We're starting to actually look at what is happening for kids once they've finished treatment, what's going on with the treatment. And I don't know if you guys have heard this. This could be really new information, and I always sort of feel bad about the one bringer of the news, and some of you might have already heard this information. But what we're finding in kids who've sort of, as they go into adulthood, so as they're getting older, that we're definitely seeing that they're more likely to be overweight. And this is compared to, I guess, kids their own age. And they've done studies of this where they've compared kids who've had cancer treatment versus kids who haven't. And kids who've had cancer treatment are more likely to get these than, say, siblings or peers. So we're definitely seeing overweight. And that's actually happening for patients with ALL on treatment. We looked at those and we saw that kind of on the first lot of steroids, weight goes up and then it goes down a little bit. And then for the next lot of steroids, it goes up quite a lot and then it sort of stays up. So we're definitely seeing higher rates of sort of overweight, especially with the ALL patients. We're seeing higher rates of type 2 diabetes. Again, this is not in patients who are 6 and 7 years of age. We're talking about into adulthood. So we're seeing high rates of type 2 diabetes, high rates of heart disease, and high rates of osteoporosis. Now, these aren't because of diet alone. This is a single these ones out because they also can be affected by a diet as well. And that's, I guess, where my interest came in is we actually do need to focus on diet after treatment to help prevent some of these potential. So I'm back. So like I said, a lot of these we're looking at is what can we do to prevent these, and diet definitely plays a role. And there was a study that was done in, again, adult patients, adult survivors of cancer. And we saw that those who had better diets as adults actually had less risk of these kind of symptoms, especially the metabolic syndrome, which is sort of a combination of a few different of these, so overweight, diabetes, blood pressure. So now let's get myself settled. So I'm actually hotspotting to my phone. So I guess you guys are going, okay, well, yes, we know diets are bad because we live it every day, but what should your child be eating after treatment? Now, what I want to do is I want to go into kind of what we're looking at for sort of eating patterns, and then I'm going to talk about some behavioural strategies, because for a lot of you guys with younger kids, sometimes it's not about what they should be eating, it's about how to get them to eat. So we will talk about that, I promise. Now, I guess a lot of time families will say to me, okay, well, is there any diet that's going to help with my child's survival long term? And you know what, up until recently, there really hasn't been much research with that, because we're looking, there really hasn't been, like, diet hasn't been such a focus. But what we're starting to find is slowly, and it excites me as a dietitian, is that we're actually starting to look at research going, what diets can we sort of recommend, or what dietary patterns can we recommend that might help with both adult and child survivors. Now, there hasn't really been done anything in kids at the moment, so I just want to say that this is all adult work, especially in the areas of adults with who've had breast cancer or prostate cancer. But I thought I'd talk about this because we haven't done anything in kids yet, but I thought it's quite interesting. And what we're starting to look at is different diet patterns, and that's what we're looking at. So food, not nutrients. And there's certain patterns. So there's one called the DASH diet and the Mediterranean diet, which I'm sure you've heard of. And the thought is that those dietary patterns are actually going to help with long-term survival. And again, that's really interesting, because those diets are also going to help reduce risk of things like heart disease and diabetes. So we think they're working both ways. And I mean, the reality is probably, what diets are these? And I will show them on the next slide. But what we're really seeing is a lower intake of animal products, especially red meat, and a higher intake of plant-based foods, which is actually no different to what we're saying for the general population as well. So what is the DASH and the Mediterranean diet? Look, they're just different dietary patterns. They're kind of very similar. They're basically cutting down or reducing things like meat and increasing plant-based foods. But that's not, like, you don't have to cut out all meat, but it's just about reducing and increasing the plant-based foods. And I know a lot of you are like, but my kid eats no vegetables, what are we going to do? I will get to that. So again, the DASH diet is more of a slightly higher carbohydrate, but more of those whole grains, so those high fiber foods, and lower fat and salt. It was actually originally made because of patients with blood pressure, adults. And then the Mediterranean diet's similar, but the difference is it's more of a high fat diet, and especially those really good fats, things like olive oil, which is, is really good for us. So Mediterranean diet patterns, and I've got both of them there. So again, things like whole grains and fruits and vegetables, but also things like seeds and nuts and beans and legumes, and a little bit of fish and seafood, and small amounts of your chicken and your eggs and your yogurt, and things like meats, and are sort of less often. Now, wine, I know you guys have got kids, so we're not encouraging wine for under 18, but this is more of an adult, this is an adult slide, obviously, so please ignore the wine part. So as you can see, slightly different patterns, but basically both of them are reducing the kind of meat intake, increasing the plant or the fruits and vegetables. And this was a great slide, but I really like. This came from Cancer Research in the UK. And again, this is just a nice sort of way of summarising it. So we want to increase those fruits and vegetables, and I think that's one that we've got really great evidence for, is that fruits and vegetables. And again, those study we did of the adult survivors of childhood cancer, it's those who are eating good amounts of fruits and vegetables that had lower rates of these metabolic syndrome. But also, a lot of people want to sort of cut out the carbohydrate foods, but there's a lot more work showing that fibre and whole grains are super important for our gut health. So they're the bugs in our system, and we're starting to learn that our bugs in our system play a huge role in our health. And to feed those bugs, you need lots of these whole grain foods. So that's things like brown rice and brown bread and rolled oats. So we don't want to cut those carbs out completely, because these high fiber foods are super important. And we know that, patients after treatment have low fiber diets. And then more of the healthier protein foods. So things like beans, lentils, chickpeas, fish, and chicken. And obviously cutting down on the processed and red meats, sugary drinks, and the high energy foods. Now that was one little pattern, but I wanted to add in the olive oil story as well. And olive oil, I think, is super important. It's a fat, which is great for us anyway. We no longer fear fat. But also there's some work. Olive oil contains something called a polyphenol, which is a form of an antioxidant. So I guess it's helping our body. It's like almost like an anti-inflammatory. And there's, again, some work being done in labs, not in humans yet, looking at polyphenol and its sort of polyphenols and its role in cancer treatment and cancer survival. So I'm not saying that you should be drinking it, you know, cups of it, but definitely don't be afraid of things like olive oil for good fats as well. So they're the kind of dietary patterns we sort of suggest, but really, I mean, it's really no different to, I guess, a good general healthy eating diet. But a lot of you are saying, well, how do I get my 5-year-old to eat these foods? And I guess your question you're asking me is, can we help our kids to eat better, considering, you know, they've spent 6, 9, 12 months, you know, not eating great amounts of food when they're on treatment and haven't learnt these good dietary patterns? And the answer is yes, we can do it, but it is a slow process. But I just want to give you a little bit of hope. I feel like this is going to be an advertisement, but it's not really meant to be like that. But we're actually starting it. We've had a trial running in Sydney out of a pilot study. And I think some of you might have been at the Anstrop Day recently and heard my PhD student talk about this. So we have a program called Reboot. And the aim of this, and we've just done a pilot study, so like a trial, because our aim is to try and help increase fruit and vegetable intake in young kids. So this is a parent study. So it's not about helping the kids. It's about giving parents like you strategies and ways of helping to help your kids to eat better, but specifically eat better with the fruit and vegetables, because that's what we found is really, really lacking. And so it's a 4-week course. It's actually based on a study done out of the University of Newcastle, just out of Sydney. And they had used this program for kids, so kids in the general population, and they were able to increase their fruit and vegetable intake. So we adapted it for kids after treatment. So I just going to keep checking my phone just in case I have messages. No, I'm good. And so this is a 4-week program. It's a parent-based program. And after the program, 46% of the kids who undertook the program, so half of them, improved their veggie intake. Now, some of them already had good, some of them who didn't improve actually already had good to start with, but we definitely found those who didn't have great veggie intake improved, and 60% of kids improved their fruit intake. And after Reboot, he's been asking for more things. This is a quote. He really wanted a carrot for breakfast, and he wanted carrot and peas for his snack. After Reboot, he had a banana smoothie. He would never have had a banana before. He's more courageous trying new foods. So again, this gives us hope. This was a small study, and we're going to do a much bigger trial, but showing that there are things that you can do and behavioural strategies to get your kids eating more fruit and vegetables. Now, what we're doing is we are about to start a much larger trial. We've actually moved this program online. So it's online, and it's going to be with some telephone support. And we're actually about to, probably in the next few months, run a much larger trial, and we're doing this across 4 centres in Australia. Saying that there's actually no reason why, if any of you guys don't want to, if you want to be part of this program, it is a study, that we can't facilitate that, because a lot of it's online, and the telephone we can just use something like Zoom. So, and it's more of a support service. So if you guys want to, I'll leave my email address at the end. You can feel free to email me. So again, and then one day we're hoping this program will be available for all of you guys. But what this program is, it's less about telling you what you need your child to eat and more about how to get your fussy eater trying new foods. And these strategies are the strategies we would use for kids who are fussy in the general population. I do a lot of work in the kids who haven't had cancer around fussy eating. In fact, if you want to read like some of my blogs about fussy eating, they're going to be really relevant to you. So if you just Google Dr. Jennifer Cohen, I have a website that has lots of information about just general fussy eating, and a lot of it will be relevant to you. Because what we want is, what you've got to sort of remember is that a lot of the fussiest, yes, there is probably taste changes and there is change in appetite, sort of regulation, but a lot of it is behavioural, as in it's like they haven't been exposed to new foods. And the thing about getting your kids to eat more fruits and vegetables and better foods, it's going to be a slow process. But that doesn't mean you shouldn't try, but there's a few little strategies I've got here, and this is only a small amount that I've got in a very short space of time, and we cover a lot more in the program, and there's plenty out there. But first thing is, a lot of what happens on treatment is that food is used as a reward. You know, if you eat this, you know, when they have procedures, they get lollies and stuff afterwards, or a lot of the, if you eat this food, then we can maybe avoid the tube. So there's a lot of kind of stigma around food. So first we want to do is take away that stigma of food and that kind of I guess, value that food has. So things like not using food as a reward, not using bribery at meal times. If you eat this, you'll eat this. What we want to start doing is introducing good eating habits. And what you guys have got to think about is with your kids' diet, yes, you want them to improve as early as they can, but you're also thinking about the long game. So when we're starting to see things like the diabetes when they get into adulthood, so we want them to be starting to learn good habits now. So when they are adults and you're not around, that's when the good dietary habits have really happened. So it is going to take a while, and you need to think of the long game. And total restriction is not always the answer. And again, I could talk about this for hours, and I've got some great blog posts about this. So just go and check them out. But I don't expect you to do total restriction either to get your child eating, because there's lots of other things that have gone on. And your kid is not going to just start wanting to try new foods. So what we tend to say is that it is okay to say no. So if your child is, someone who is got that kind of insatiable appetite, it's okay to kind of say, no, this is the meal time, this is a snack time, and if you're hungry, you have to wait to the next meal. But also doing the whole, there's no other foods at dinner time is not going to work either. So what we then tend to do is say at meal times is serve, foods a combination of foods that your child is going to eat with new foods. And I've got this as my last point, which actually should be one of my top points, is that to get a child wanting to try new foods, it's about constant exposure. They might not eat it the first time. They might not even eat it the 12th time. They might not even eat it the 20th time. But you need to keep serving at meal times. But just serving a new food they don't like is not going to work. So at meal times, serving a combination of liked and non-liked foods, but constantly exposing your child to new foods in kind of a stress-free environment. Make sure you're consistent between carers. I think that's a big thing. So make sure you're on the same page with who else helps feed your kids. Praise good behaviours, but not with food. You played with that food, that's great. Because again, a lot of the time, kids who've got sort of fussy eating, especially after treatment, they're almost afraid of new foods. And so getting them to eat a new food is not going to be the goal straight away. Getting them to play with the food and be less scared of the food is a goal. And so praising those good behaviours. Yeah, you touch the food. So getting them comfortable with new food and praising those good behaviours. Parents modelling good eating habits. And I will say this for anyone, whether your kids have had cancer treatment or fussy, because they're fussy, is family meals. Eat together as a family. You as parents model good eating habits. Because a lot of those family meals wouldn't have happened while your kids were on treatment. And I know that because it's just too hard when you're in hospital. But now trying to do those family meals, show kids and show you and your partner and everyone else eating all of these foods, and that's going to help them to feel less fear of these foods. But do other fun things with food. Don't just make it about eating. Involve your kids with food preparation. Go shopping with them. Okay, don't always go shopping with them. I've got a 5 and a 7-year-old. Sometimes you don't want to, but sometimes go shopping if you're not in a rush. Do food preparation. Plant a garden. Again, it's about getting them excited about fruits and vegetables and exposing them to them. Access to fruit and vegetables. Make sure that they're always available. Even if your kids don't eat them, have them cut up on the bench. Put them in your kids' lunchbox. They may not eat them, and you do have to get used to waste, and I do apologise for that now. Your worm garden, start a worm garden so they can have all the scraps. But having constant exposure to the food. And I think that's probably the most important, is constant exposure, not expecting them to eat the food straight away, but having that kind of stress-free thing about food, but lots of sort of happy thoughts around food, but not expecting them to eat it straight away. It's a very slow process, but constant exposure is really, really key. So actually that's probably me done for now, and then I can open up. I didn't want to have this too long because I know that there'll be quite a few questions, and I've got some there already, and I've worked out how to do it. But my take-home message from this is that unfortunately a child does need to work harder with nutrition than their peers. And I'm sure a lot of you probably know that, and it's kind of true. So we do need to work harder, but I don't want that to be a constant stress for you as a parent. But just have that at the back of the mind, that they do have to work harder. They have to work harder because they probably need better diets than their peers and their siblings, but also because they've had so much going on that's going to make it harder for them to want to eat. As far as what to eat, really aiming for that Mediterranean style diet pattern. So again, if they're really fussy eaters, you're not going to get there at first. But if you can start with small changes, even if you can change your oils over to extra virgin olive oil, and you can, you know, get some, you know, 1 or 2 veggies into a meal, or you can cut down the red meat and have a little bit more fish or chicken or start legumes or something. Even if it's just small changes, that's the kind of dietary pattern we want. Please take the small wins, because you're not going to go from tomorrow going, okay, now they're eating Mediterranean style diet. Take the small wins and know that it takes a long time, and sort of reflect back of where you've come. And, you know, you saw on those quotes, one mum was so excited their child had a banana smoothie. And that's what we want to see. It's the small wins. And again, what you're doing is you're in for the long game, not the short game. We're trying to get you to set up long-term good habits. And that's going to help you to, I guess, keep going when you're only getting those small wins with your child's eating. So I am going to put, so that's my email address. As far as the study, if you guys are interested, and you don't have to, but if you are interested, so this is a parent-led intervention, which means basically we're looking for kids who finish treatment. We will take those if they're on maintenance therapy for ALL, but if your kids are off treatment, and we're looking for kids younger because it's a parent-focused intervention. So basically, if your child is currently sort of 13 years or under and finished treatment, and you want to take part in the actual study where you get all of this information, not just in 10 minutes, send me an email. We haven't opened up the actual study yet. It's probably a few months away, but I can put you on a list and put you in contact with my PhD student who's doing the study. So that is me. I have left, let me see. Oh, good. I've left plenty of time for questions. I've got someone going, Mediterranean, awesome. Okay, so that's good. And the other question is a longer one. And so if you've got questions, just please type them in the chat box and I'm happy to answer them. If you don't want to do it in this forum, then please send me an email. I'm very happy to. But I've got this one. So my daughter suffers chronic fatigue from the chemotherapy. And while I knew her energy was being zapped, this was only diagnosed last year to my desperation of having a doctor help me with her energy. I know it's really hard to work out what's sort of long-term or what's the chemotherapy. The doctor went above and beyond her ecology notes and confirmed chronic fatigue. I've definitely felt like there's been no support outside of treatment to support myself and parent with nutrition, 100%. This is why I started the research. I'm a clinical dietitian. There was time for me to see patients on treatment, obviously patients having a bone marrow transplant, but off treatment, we just don't have the capacity, which is also why I have this program and why we've moved it online, is that eventually I want this available to all parents. Even if you haven't got a person one-on-one like this, at least you've got information out there that's available for parents. Treatment to support herself, gut health and foods building her immunity back up, as well as blood type diets. My daughter is gluten and dairy intolerant, and this is ignored when she's on treatment. And our dietitian pushed dairy liquid, which made her much sicker. We also got away from juicing, which blew us away. It's really, really hard because the focus on treatment is prevention of weight loss, and that's actually really important as well. And there's really good research around that we know too much weight loss is not good. But I know myself, and I've been doing some work now looking at diets on treatment. That paper hopefully will come out in the next few months. I'm hoping to submit it to a journal to publish. But I now want to also focus on what's going on during treatment, which is not going to help you guys because you guys are already past it. But I do agree that I want to now focus on what can we do on treatment. So I'm calling it a healthy, high energy diet. So we still want to prevent that weight loss. So I'm like, lots of olive oil, lots of nuts, lots of nut butter, lots of avocado. And I'm definitely trying to get, and we haven't started yet, but that's what my sort of ultimate aim is to do something like Reboot, but on treatment. So I do agree with you. I think the juicing thing is just always about, we still don't want kids losing weight during treatment. So it's about how can we sort of keep that weight up. And we've developed it at Sydney Children's Hospital, and we're just piloting it at the moment, like an information resource on what we call healthy high energy. And what we try to do with that is do sort of things like drinks and smoothies and things that weren't milk-based. And I don't have a problem with milk, and I will encourage it, but I also know lots of kids don't like it and can't drink it. And there's other ways that we can encourage eating on treatment. So we're trying to do some work around what can we do about, I guess, non-dairy drinks and smoothies to help with the weight. So as far as, building immunity up now, like I said, this is really early research. I really think something like the Mediterranean dietary pattern is going to be the way that we're going, because for gut health, we know that fiber and whole grains are so important to feed that good bacteria. It's what they feed on. And so helping to build up that, that good bacteria is going to be something like a Mediterranean style diet, because it does have lots of those fiber and whole grain foods that are going to help with the good gut bacteria. So I hope that kind of answers your question. I guess we're still learning and there's still lots to learn. And so I guess that's my research. If I can, you know, get funding over the next 10 or so years, is to really start delving deep into dietary patterns. And we just don't know enough yet. So that's why we're sort of like Mediterranean diet is probably where we can go at the moment. And I think it's a great diet. It's a great diet for all of us, really. It's what we should all be on. My son still struggles with graft versus host disease. Oh gosh, that's a tough one. Can't seem to gain weight. He's 2 and has remained the same weight, under 12 kilos, since before he started BMT. Makes her really worried. He's my only child and I don't have any context of normal childhood physical development. The doctors don't seem concerned. At what point can I really put my foot down and notice his weight gain and low energy? That's actually a really great question, and it's one that I could probably answer a little bit, but without, I guess, the sort of full medical story. I can't give you lots and lots of advice, but I think what you said about not having another child to know what's kind of normal is an important one, because, you know, all 2-year-olds can be fussy with their eating. It's sort of actually a normal part of toddler development. In fact, 50% of kids are fussy at the age of 2. Saying that, because of the graft versus host disease, there's going to be, and I'm assuming it's of, I don't know which part, but if you're getting graft versus host disease, it's coming of the gut. So you're getting a lot of sort of malabsorption or diarrhea. Then we do see lots of issues sort of with weight gain at that point in time. I guess I'm assuming that you are seeing a dietitian, and I think it's probably just keep having those conversations, because if they say 12 kilos for a long time, I think it's worth pushing the point of having some discussions, because we do want weight gain, especially with the graft versus host disease. It's really tough, especially when they're trying to balance. And if you're still on cyclosporin, and again, I don't know, but if you're still on cyclosporin, that can cause problems with eating as well. So I think it's definitely something that if you're worried as a parent, then keep talking to your doctors and make sure you're chatting with your dietitian as well. So that's probably the most advice that I can give now, just without knowing your history and being able to, you know, we don't have the capacity to do that. So I think definitely just go back and have a chat and see what's going on. I think we can wrap it up here, but I'm there. Please send me an email if you've got any questions, and I'm very happy to answer. So thank you all for listening. I hope you've got some information. And like I said, please email me and tell me what other information you'd like to know, because I'd love to know that for future presentations to parents.